I want to start by saying thank you. Thank you to our healthcare staff, thank you to our social care staff and you in our local communities across Devon, because you have responded magnificently throughout the coronavirus pandemic and you continue to do so. Devon has seen lower COVID-19 cases and fewer people have died than in other areas of coronavirus. However, as with other parts of the country, we're now seeing a clear increase in cases, with more people in hospital with coronavirus. So the number of people in hospital with COVID is now greater than the peak of the first wave, and is expected to continue to keep rising. So what are we doing in the NHS to try and cope with that extra pressure, but also to keep people safe? Well, we're working together both in our hospitals, in our community teams, in our primary care teams, to make sure that we change our layouts both on the wards and in general practice to try and keep COVID and non-COVID patients separate and therefore offer as much protection to patients as we possibly can. We're making sure that our staff are wearing the correct personal protective equipment, and also we're doing as much as we can without people having to come into primary care or into hospital. And that's why lots of things are happening over the telephone or online consultations or video consultations. Also, unfortunately, we're having to put into place some visiting restrictions. And this is to ensure that our patients, our staff, and you as the public are kept as safe as possible. Many of you will know about the Nightingale Hospital in Exeter. It has been providing a wide range of services, including CT scans and ultrasound scans, and the hospital has now switched to its primary purpose, which was to treat people with coronavirus. Our hospitals are continuing to provide services for patients without coronavirus, such as planned procedures and operations, and they're doing everything they can to avoid postponing appointments and other treatments. Even so, some procedures are having to be postponed, especially when there are a number of staff who are off sick or having to self-isolate, both because of coronavirus, but also because of the usual winter ailments that we see at this time of the year. If you are affected by this, you will be told so directly, and we will aim to get you back in for your treatment as soon as is possible, as soon as is safe. There is a light at the end of the tunnel for this and a route through to normality that is the coronavirus vaccine. And the NHS here in Devon, as in other areas of the country, is preparing to make sure that we can deliver a programme that gets our population vaccinated as quickly and effectively as possible. We will, of course, be concentrating on those who need it most, and that will include the elderly, those who are most clinically vulnerable, but also to protect our health and care staff. So that we will make sure that they get the vaccine as soon as it is available. Every year, the NHS in Devon has delivered flu vaccines to a large number of people, and we have a strong track record of being able to do these mass immunisation programmes. So we're building on that expertise that we already have, so that as soon as a vaccine is ready, we will be too. With coronavirus still circulating, it's important, in fact more important than ever, that people get the flu vaccine. And we have seen more people than ever before come forward to get that vaccinations. What we can now offer is that all people aged 50 to 64 can also get their vaccination at their GP surgery for free this year. And that's on top of the usual groups, including the over 65s, people who are pregnant and those with long-term health conditions. In the coming weeks, practices will contact you if you're in that 50 to 64-year-old group to arrange for a vaccination. Please don't contact your surgery. They are making all the necessary arrangements, and as soon as they have the vaccines available and the clinics available, then they will contact you to arrange that. So our message to you is continue to attend your appointments within the NHS, whether that's at your GP or in outpatients or at hospital, because we will do everything we can to make sure that that is a safe place for you to come to get the healthcare that you need. If you need to see or speak to your GP, contact them online whenever possible. But if you can't, talk to your practice so other arrangements can be made. And help reduce the spread of the coronavirus by following the national advice of hands, face and space. Wash your hands frequently, wear a face mask when you're in public, and keep your distance from others. We're working really hard to keep you updated, and this is the first in a series of weekly updates. But if you want more information, you can also visit your local council and NHS organisations' websites, and on there will be latest information and advice. Again, thank you for everything that you have been doing to keep your family, your friends and your neighbours safe.